tell them we built this whole plan so you can safely consume, as much of this as you feel you need. But we know that even if you were to use all 4 of these products throughout the day that we recommended at the max dose that we recommended, we know that you have a high chance for feeling good and a low chance for side effects. But if you feel like that might be a bit much to start, you prefer not to spend the money and just start with one, that's fine too. And we've seen fantastic effects, even sometimes that surprises the hell out of me, from patients using one singular product to 4 at a time. So we give them back that autonomy, follow up, and it works out.
You're going to love what, and I'm sorry, hold your comment for a second. We are back with another episode of Meat Unshackled at the Emerald Conference 2024, San Diego, California. Another beautiful event with lovely people and great conversations. I like my conferences smaller, where you can get more intimate and have 15, 30-minute conversations. It's from the same people as MJ BizCon, but at MJ BizCon, people are like 1 minute, 30 seconds. Where's the party? I'll catch you later. I'll catch you later. I'll catch you later. There's nothing wrong with that, but you don't have the long, in-depth conversations that you would otherwise get at a smaller conference.
Sure. Yeah.
So I'm here joined with Ryan and Rebecca, and I'll let you guys you probably want to introduce Ryan. So
sure.
Rebecca, why don't you introduce yourself first?
I'll start first. So Rebecca Abraham, I'm a registered nurse, former critical care nurse, and I am the CEO founder of Acute on Chronic, but now soft launching as Plesio Health. So we did a little bit of a name change. What we are a personalized dosing and precision health education platform where we use registered nurses to guide patients, as well as machine learning, to get accurate dosing and product recommendations. We have a 9 out of 10 success rate with our patients. Very affordable, and it works.
What, and how do you pronounce the name of your company again?
Plesio Health is the new name.
Plesio.
Yeah.
How do you spell that?
Plesio.
Plesio Health.
Yeah.
Okay, cool. And you guys are based out of where?
Based in Chicago. We work in all 50 states, and sometimes we even do education and talks internationally. So my background, I come from critical care nursing. I created the company because there's a huge gap both in healthcare and the industry. This is Dr. Ryan Buck. So he and
Dr. Ryan. That's that's like Patriot Games kind of name, right?
Right. So I found a guy who worked in academic medicine. No, I didn't find him. We worked together since I was a nursing student and he was in residency. So we go way back. Then he worked in the same department at the hospital as my husband. And, we all became friends. And then I came to, it was my husband and his colleagues like Ryan that were like, yo, people need help with cannabis. Our jobs may not allow us to help people, but you know who we would trust to help people? Nurses. And so that's where my company started. And as I started doing the work and people started to look good, we would talk about the research. And he is, trying to climb the academic ladder. And that's when my husband and I came to him. We were like, hey, you want to do some research? This might be some cool unique research. He saw that it looked good, what we were doing. He saw the effects on the patients. We are very word of mouth. So, he joined in to help us do research and get published because it's a cool new science. So.
And Ryan, when did you join?
I joined sort of unofficially, I think, in 2021, but then officially about a little over a year ago.
Yeah.
And so what's the journey been like?
It's been, I think that I many of my colleagues started off with this very cannabis seems interesting, but, does it really work? What's the evidence out there? Just because there's a real dearth of education in traditional, academic medical system. And I think it took seeing Rebecca starting the business and some of the great results that she was getting that caused me to then go and actually look for myself, at the evidence that was out there and educate myself on it. And the more I learned about it, the more I was like, oh, this is, the endocannabinoid system is this amazingly complex, very important system that we know or that we learn very little about. But it seems like there's a reason why it could have all these, sounds too good to be true. You're like, it can help you with this and this and this and this. Like, how could any one thing possibly do that? Well, when you're, incorporating a system that literally controls, homeostasis everywhere in the body, of course it may have beneficial effects everywhere. So,
I can't explain it like you can.
Yeah.
But I did come in 2012 with this Western medicine. If it's not coming from an MD doctor from the University of Arizona or John Hopkins, it's not real.
Yeah.
And I had poo-pooed not just cannabis, inadvertently, all plant-based medicine.
Yeah.
I mean, just eliminated a whole world of potential healing from other types of therapists, doctors, because of my, I guess because how we were raised culturally. If you can't absolutely prove it, it doesn't work.
Right.
And so I had to change my mindset over the years, and that was my first 3 years in cannabis, 2012 to 2015. I had to unravel all the thinking that I had about cannabis not having a valuable therapeutic medicinal use. And so, I went through that journey, and I still can't explain it as well as you can, but it's absolutely true.
Mm-hmm.
So that's fantastic. It actually, I don't, this podcast isn't about me, but it helped me eliminate understanding substance use, substance abuse, and substance use and substance policy. Substance access policy helped me eliminate my alcohol consumption.
Yep.
Because I started to ask myself why and when and where am I drinking, and how and why, and so I started to think about it, and I almost entirely eliminated it except for a glass of red wine.
Yep.
My logic there is Alexander the Great drank red wine, and he wasn't inundated at that point with all the commercial messaging, marketing, capitalism, all these different little methods and ways that they inundate us and convince us to use things. So, well, that's fantastic. So, tell us more about how your business works.
Yeah. So, how it works. So, we have two sides to the business, and we have kind of this all-encompassing full circle. We're B2C, we're B2B, and then we're B2B2C. The first part of our business and what started our business was one-to-one telehealth nurse consulting. So typically how a patient finds us is either through a friend, somebody who they know through the cannabis industry, they've seen my social media, or typically it could be a doctor. They ask their doctor, hey, let's use chronic pain, great example. I have chronic back pain. I heard cannabis can help. They've already tried something like injections, steroid injections. They've tried regular steroids by mouth. They've tried Tylenol, ibuprofen a day. They ask their doctor. Their doctor says, I have no idea, but maybe you can call these nurses. They say they're cannabis nurses. Patient comes to us. We call it the Plesio plan, and there's 3 appointments where the first one you meet with a nurse and you give input to us. You tell us everything about you. Then there's a process for personalization where our nurses do our precision dosing, where we've created an internal methodology and algorithm using just traditional nursing. We merged it together and created an algorithm and a tool to help us accurately assess the patient and what they're doing. And as we grow, we can start doing this in real time as we build out our tech. But we could write down and track what the patient's feeling when they use cannabis, and then we could use that algorithm to give them a precise dose or what they should do next to get that precise dose. So is it cut THC by this much dosage? Do you add a terpene? Do you do this? We then present the plan to the patient, the Plesio personalized plan, and we give it to the patient, and then the nurse goes over the process and educates. Like, we tell the patient exactly how cannabis works so they know it's not snake oil and they don't think this is some sort of like, just placebo effect. And we want them to.
But even if it was, it's okay. That's something I realized.
Yeah. I can drone on and on about like we don't study like the positivities of the placebo effect because like that doesn't make anybody money. But yeah, there is actually like a health benefit to the placebo effect. So if it is the placebo effect, great. But
a lot of my life and things are based on placebo.
So
if I was honest with myself.
when we teach the patient, we just want them to know what they feel in their body, and they could like maybe imagine the cells doing what they're doing.
Yeah.
And then so they get this personalized plan, and then they go get a follow-up appointment to help them plan for the future. When they tell us, we feel better in this way, our side effects are this, oh, my blood pressure went down, these are things our nurses help them manage. So like, for example, we have patients all the time where their chronic pain gets better. And then what cannabis can do, this has not been thoroughly studied, but we've seen it in enough patients, and there are studies that correlate with what we see, where cannabis vasodilates, so that means it opens up your veins, which can make you feel, it lowers your blood pressure. That's why a side effect of cannabis is being dizzy and sleepy, sometimes even on CBD. So it is lowering people's blood pressure. So like, let's say that their appointment, they're like, I'm feeling great, but my blood pressure is low. I feel a little dizzy. Oftentimes we'll call their physician, or have our pharmacist call the physician, or have one of our physician to physician to be like, hey, your patient's decreased pain, but also, we see they're on amlodipine, and cannabis can do this. We educate their physician, and then we're like, can you cut the dose of this, or do you feel okay deprescribing if we monitor the patient's blood pressure? They have no pain. Oftentimes the physician, once they talk to one of us and we give them the science, they're very amenable, and they're like, great, that sounds awesome to us. And then oftentimes the fourth time we see the patient, we're like, how are you doing? They're like, great, my dose is fine now. Hey, actually, I'm off my amlodipine, and I don't have to take ibuprofen every day for my back pain.
And you guys can receive calls and give advice globally.
Globally, technically, yeah.
Globally. So how do you deal with the issue that somebody calls you from Florida, somebody calls you from California, and you give them advice as to what they need, but then the access and the products are all different. They say, now what?
Yeah.
Because they have to go to figure this out now through dispensaries.
So this is something we actually deal with a lot, where we have snowbirds. We're based in Chicago, so we get a lot of Midwest. We tell people to please try. And so the way we do our work, we tell people specific products, but then we also tell them like what was in those specific products that made us recommend them. At the end of the day, it is the patient's choice. So why I made it the patient's choice is, in healthcare, if you've ever been a patient, you know the minute you step into any kind of outpatient, inpatient healthcare facility, your autonomy kind of leaves the building, right? Like, imagine an ER stay. You get this awful, ugly gown, and then you're kind of bossed around for the next 6 hours. You're told, like, you could take this, and if you don't want it, tough cookies. What's nice, and that happens in outpatient medicine too, what's nice about cannabis is we give them a list of 2, 3, sometimes 4 products, and they're like, do I do all of them? Should I do one? And we tell them, like, honestly, it's your choice. We tell them we built this whole plan so you can safely consume, as much of this as you feel you need. But we know that even if you were to use all 4 of these products throughout the day that we recommended at the max dose that we recommended, we know that you have a high chance for feeling good and a low chance for side effects. But if you feel like that might be a bit much to start, and you prefer not to spend the money and just start with one, that's fine too. And we've seen fantastic effects, even sometimes it surprises the hell out of me, from patients using one singular product to 4 at a time. So we give them back that autonomy, follow up, and it works out.
You're going to love what, and I'm sorry, hold your comment for a second. You're going to love what just happened to me. About 8 days ago, a friend of ours who's been in the cannabis industry with us 10 years, she got diagnosed with stage 3 or stage 4 cancer, some form of cancer. And she's out of money. So her caregiver, because she had a stroke and she couldn't move, called me and said, Dimitri, we need RSO, we need THCA, we need cannabis products for her so she can, utilize them. And she's also doing chemo and stuff. And I'm like, well, what does she need? And she's like, well, she just wants everything, anything. And so I put out a call, and all these different brands in Arizona just gave me all these different products. Yeah. And all these different types of different types of products that she could use, but nobody, and she was really grateful. And then she got them, and I haven't talked to her or her caregiver like in 3 or 4 days. But whether it's placebo, whether it's whatever's happening, she's going to get a little bit better. Maybe she's going to get totally healed. I don't know, but it's what she wanted. It's what people have a right to.
Yeah.
And but there was no way of like knowing exactly which of all these medicines,
have her call us.
I had this one
is a
guy.
Promise. Have her call us. We'll see her for free.
I should have just had her call you.
Yeah, and now she can. It's only been
Yeah.
3 days. It's not too late.
No, I'll do that. That's gonna. We're gonna do that. Her name is Tina. She's a wonderful
I
person.
recall.
So she's got a lot of product.
That's fine. And we have a program where we are doing pay what you can care. And Arizona is one of the states. So yeah, have her call us.
But then I was thinking, so you have all this information,
Mhm.
and you have it more scientifically what they need.
Yeah.
But then there's these products, and that doesn't really correlate as well as it should. How we can, you know what I'm saying?
It's not a perfect system yet, but
Yes.
we know how to use what we have in the market, in the whatever market. To go back to your original, we know what we have in the market and what we have to use, and we combine multiple things to make the endocannabinoid system work with the products we
Okay.
have. So we've gotten really good at managing products in the state of Arizona versus the products in the state of Illinois. We even know how to work in more difficult states like Florida, where like getting a med card is more difficult because you have
Right.
to see somebody in person and there's a lot of barriers. And then we help people in states where it's only a hemp market, but there's a lot we can do with the hemp market. And remember, the endocannabinoid system is mostly run on plant-based cannabis. But my favorite thing is there are other supplements and there are other foods and there are other botanicals that stimulate the endocannabinoid system. So if a patient is in a state like Wisconsin, Indiana, some of these like nothing, there's nothing here, we can still actually help that patient with even non-D9 hemp from out of state because it's legal. And then we recommend other things like PEA is something that it's a supplement. Don't ask me to say a little scientific name. It's a very available supplement available at like GNC, Walgreens. And it stimulates the endocannabinoid system and is really effective for arthritis or like peripheral neuropathy. So things like that we could use. Chocolate, lettuce, exercise. You'd be surprised. So we can take the little bit of market we have in a restricted area and we could really make that fly. Same thing for Arizona, Illinois. I mean, like places like California, it's almost kind of easier to do our job because there's an abundant of products and more quality products. We pull the COA, we see what's going on, we see that it's safe. And then, of course, informed consent and risk. Cannabis is much more safe than damn near any supplement or pharmaceutical that's out there.
Yeah.
People don't necessarily know that. And we always have to keep in mind there's been millions of dollars tossed at it to find the downfall. And people have been kind of winging it for over 1,000 years. If you were to wing any other drug, any other supplement, any other food, any other vitamin, we'd have a lot of dead people. Like if people went to like Walgreens, right, or CVS, or what's out here? Rite Aid, you guys.
Oh, CVS.
Yeah, I was like, what do you have out here? If you were like, I'm going to take some vitamins and like, I'm going to be healthy and see what happens. Like you could truly end up in the hospital with like over-consuming iron or like.
Are you good?
Oh yeah,
I know that.
yeah. Chinese herbs, like if you do the wrong amount, like. Yeah, right. He's seen some things.
I better be careful.
We both have. Yeah.
My mind is wide open to the world of possibilities at this point. Maybe it shouldn't be.
So like there's and people, we have an open market for people to do that. And like when you kind of mess around with supplements and vitamins, even the ones that are very legal, like you could run into problems. And people do that with cannabis all the time. And we see, nothing's perfect. We see some side effects, but like nothing that's going to kill you. And so that's what's great about cannabis. So we could really work in every market. Would we like the products to be better and more consistent? And would we like to see more routes of administration? Would we like to get to IV? Do we want to see more variety in gummies?
I love what you're doing.
We could work in any market.
And you're bridging the gap that needs to be bridged, which is fantastic. Because for me, I'm still trying to figure this all out. As I said, cannabis opened up my mind to a whole world that existed when COVID came through. I went to a naturopathic doctor, and the first thing they said was take off that mask. None of the people in the office were wearing masks, and they said, we're right next to the Mayo. They come over here. We're not afraid of a little bug, and they did 7 different things. Little pellets. I didn't even know what was in them. Vibration therapy, which was really good for my congestion. I was like vibrating for like, I'm like, do they do this over at the Mayo? And she was like, well, they don't have an insurance code for this. They did massage, and it was fantastic. Anyways, my point being is that obviously, healthcare and what's available out there to humanity is much more complicated than we know.
Yeah.
And so that's when the cannabis prior to the cannabis industry, I was very narrow minded on that. And there's nothing wrong with all these other methodologies that are really, gone through an intense, rigorous scientific methodology, but there's more.
Yeah. We
No.
essentially just believe in like.
Can't wait till the aliens arrive and bring the, with that little thing on Star Trek where they go, and they don't have to do surgery.
Nothing. Yeah.
That's gonna happen one day.
So we believe in like just giving people the entire story. So like we're very much in the middle. Like probably your naturopath wouldn't care for us too much because we would probably like debate some of the things like when you're like, we have this thing that makes your chest move and it helps, and they don't do it over there. There's no code. That's actually he lied. We do that all the time.
It was a vibration thing.
Chest physiotherapy all the time. We do a code for it. Yeah.
It was
so we find ourselves at this intersection.
So keep that thing shaking.
We kind of it's kind of like a gang war between like traditional medicine and the institutions and Western medicine, and then kind of newer alternative therapies. And there's a gang war. The alternative therapy people do not want to acknowledge, kind of our existence. I kind of put us like right in the middle, kind of left of center. And then, the institutions always kind of sometimes very prematurely like poo-poo anything going on. And the biggest thing that I think we completely bridge is not just cannabis, but like both of these things can exist and we both can talk to each other.
Yeah.
And like not everything over on the institutional side and system side is perfect. Like we do so many things that are, I want to curse, but I don't want you to get bleeped on YouTube or something. There's so many things we do that are like kind of bad and probably not right. We kind of know it. It's just kind of the way it's been done. And we could definitely change that. But then on the alternative health side, like there's definitely things like maybe we shouldn't be doing that. Or like, why not I just accept this risk? A joke I often tell is like, look, I love preventative medicine. Like I love like alternative. I'm down to try it. Like I remember a couple years ago, when everybody started talking about the gut-brain biome, and like initially the first people that were like, what you eat in your gut and your stress is related to your brain. And like those physicians were like laughed out of the room. They were right. 20 years later, it's like, oh, there is an enteric brain. And we didn't know that. Sorry. We were sorry we called you dumb. But there's lots of things like that on the other side that are not being taken seriously for no good reason. So I always say like, look, there's a lot of things that I'll try alternative therapies for. Acupuncture, I think, is great. Stimulating the endocannabinoid system. There are things that are based in very real science that just don't really like scale and profit as well. We're lucky that we're also at an intersection where we could like scale what we do and patent our technology. But just because it can't be scaled and patented by a pharmaceutical company doesn't mean it doesn't work. So I say like, for everything else, I'll try anything as long as it doesn't, hurt me. And I know what the possibilities are, but like if I get hit by a car, don't sprinkle essential oils over me, call the trauma surgeon.
Well, what I know is that I'm going to put your cell phone number in my phone.
Yeah.
And I'm going to call you first.
Yeah. Call me first. I'll be like,
you know so much more about this subject than I do. And I don't like some people, they're wrong or they're right. I just kind of try to mind my own business.
Yeah.
There are subject matter experts, and you are clearly a subject matter expert.
And,
so,
I've seen with my colleagues over the last 5 years that there has been, a change in the opinion. Like before, there was a lot of hostility, a lot of like, no, this is there's probably nothing good here. And now there's a lot more people that are interested and open to it. I think partially, seeing the travesty of like the opioid epidemic and people are like, we need to get people on other things, but so I see so many people, they take the opiates away and then the patient's like, okay, what now? And then docs kind of throw up their hands like, I don't know what else now. And so I think there's a lot more interest. And I think where there is still the biggest barrier, I think, is just a lack of education. Is that I know a lot of, colleagues in more kind of traditional medicine that are like, I think there could be something here in cannabis. I just don't feel comfortable at all telling people how to use it. And I don't want them to use it wrongly, and so I don't know what to say. And that's kind of where we are, both in terms of taking care of patients and in terms of our educational mission of getting out there and trying to train and kind of bridge that gap of education about this very important system and potential therapeutics. I think there's a lot of good evidence out there that it works. We absolutely do need more research to figure out how do you use the different endocannabinoids and what doses and what ways. What is the best method? I think that we definitely feel strongly that this, nursing education and guidance, that giving patients a strong basic, but then giving them a little bit of autonomy to be able to do that titration themselves to find the right dose and mitigate side effects, I think is in a good sweet spot for it.
Well, I definitely think your guys' company and as individuals, you guys are going to be on the cutting edge of this. that's one of the reasons why I come to Emerald Conferences. Some of the smartest people get together and chat for a while. So we love sharing your existence, your very existence of your company as individuals, and a little bit of your knowledge with our audience out there. We look forward to catching up with you at MG Unpacked and other conferences and following your...
I have so much more exciting things to say. So we mentioned...
we're out of time.
So next week, catch us about our precision dosing tool to license.
We'll bring your precision... Well, okay, well,
we'll talk about it.
We are going to be at MG Unpacked.
Great. Look, I just booked myself for a second episode.
Yeah. No. Catch up. You can actually interview people and ask them questions too. And I like to learn this way.
Yeah.